Hello, everybody. This is Jacqueline. How are you doing? I hope you're having a fantastic day. Welcome to this very special live all about how do I know if this is menopause. So in today's session, we are going to be talking about the different way that menopause shows up, the menopause symptoms, and how you can identify if it is really menopause or something else. So some of the menopause symptoms that women experience anywhere along their menopause journey, perimenopause, menopause, and even in early postmenopause years, can sometimes be confused with other things. So let's talk about some of the symptoms. Let's talk about some of the things that you could be experiencing during this time and what maybe it could be thought of. Maybe it is, maybe you need to absolutely go get yourself checked out. But let's just sort of unravel some of this stuff going on. So as we know, during our menopause years, our hormones are fluctuating. And what worked before for us will not work now. So the food that maybe you ate before will not agree with you now. The number of hours of sleep you got before, you may need more now. Your mood or the way that you know your work-life balance that maybe you managed with before, that may not serve you anymore now. So a lot of changes going on, and things that worked for you before that you managed and you were sort of functioning in your life, in your daily life before, may not serve you now and may actually deplete you now. So that will be expressed in certain things such as fatigue, exhaustion, anxiety, low-grade depression, lack of motivation, bloating, stomach issues, stomach cramping, food that doesn't agree with you anymore, breast tenderness, cysts or fibroids, lumpy breasts, for example, aches and pains in your joints, foggy brain, not being able to focus, or short-term memory loss, forgetting words and sentences. These are very heart palpitations. These are very classic menopause symptoms. However, for many women, they will start to experience these things, and the thoughts that start crossing their brain are, I've got early onset dementia. I can't focus. I can't remember things. I forget where I put my keys every day. All those types of cognitive brain function things send women into a real tizzy because they think they've got early onset dementia. The next thing, such as changes in the digestive system, bloatedness, cramping, constipation or diarrhea, having sensitivities to dairy, all those types of things start to change. And women can wonder if maybe they're developing Crohn's or irritable bowel syndrome or food allergies. And all these things are real symptoms. They are not in your head, but they may not be what you think they are. The next thing, such as stiff joints or not being able to move as well, back pain, shoulder pain, neck pain, all these types of things, really difficult, sometimes swollen fingers and having a hard time sometimes moving your fingers. All of these things, it may be perceived as being early rheumatoid arthritis, early signs of arthritis. Spoiler alert again, it's not. Other things like, and this is really, really classic, and so many women have told me this, anxiety, mood swings, low mood, signs of depression, lack of motivation. All of these things get categorized or classified, diagnosed by your doctor as, low-grade depression or anxiety, and you get prescribed antidepressants. And so many women have been misdiagnosed with their menopause symptoms as early low-grade depression, or even, not low-grade depression, but signs of depression, and they get prescribed antidepressants. The sleep insomnia, the sleep irregularities, the change in sleep, you get prescribed sleeping tablets because you're totally stressed out, or you're overworked, or you've got a deadline, or you've got lots of responsibility, sandwich generation, and so you get prescribed sleeping pills. The other two things that I want to draw your attention to is thyroid function or some type of thyroid imbalance, and adrenal function and some type of adrenal imbalance. So those two things absolutely can have the potential to happen during our menopause years because of our fluctuating hormones. However, fatigue, low motivation, weight gain could potentially be diagnosed as a thyroid imbalance. However, its source is actually perimenopause. So you may get put on a thyroid medication that actually you may not need if you're going to be treating it as a hormonal imbalance, as menopause. And then there are other ways that you can treat it. So you may not need the medication at all. And that really is the crux of what I want to be saying to you women, is that your menopause symptoms are real, but they could be misdiagnosed as other symptoms of other things, and you will get prescribed medication for these so-called other things, other illnesses or other diagnoses that you actually don't have. And now you're on medication for a symptom that was misdiagnosed related to this, disease or illness or syndrome, when really it's perimenopause and menopause. That's not to say the symptoms are not real and that you're not experiencing them, but the important thing for me is what is the source of those symptoms, and therefore how do we treat those symptoms. And if you are perimenopausal and menopausal, you need to make sure you're getting a really good diagnosis that justifies whatever treatment plan you are being advised by your doctor. And in most cases, and not all cases, because sometimes there really is an underlying illness that needs to be treated, but in many, many of the cases, what you are experiencing is perimenopause, menopause related, and therefore the relationship or the interaction or the treatment for those symptoms is going to be something totally different. And that is where I come in with my 5-pillar approach of looking at stress, nutrition, work-life balance, sleep, and movement, and how we can use those 5 pillars to help balance out our hormones, replenish ourselves, to, manage or even mitigate the symptoms, and bringing it all together with regular yoga for women's health practice, which really only helps to reinforce the strategies that you are now going to be putting in place, because the yoga really helps with all the overall strategies and helps you to nourish yourself, which is the key thing during our menopause years. So I hope that's explained things a little bit. I hope that helps clarify things. And I hope that helps calm you down. Go to the doctor. Go get checked out. Absolutely. Make sure you do not have a real illness that is triggering these symptoms. And if all your tests come back clear, and if the doctor says to you, I don't know what's wrong, but just take this pill, just take this medication, it will make you feel better, you know where to find me. Have a fantastic day. I look forward to seeing you soon.